Hello dear learners, a very warm welcome to all of you. Today we are going to explore a concept that may not always be immediately visible, yet it silently guides every aspect of medical education, clinical practice and professional identity. Our focus today is on ethics in medical teaching, patient care, pedagogy and professional formation. Ethics is not something that operates only during extraordinary moments of crisis. Rather, it quietly shapes everyday professional decisions, how we speak to patients, how we teach students, how we respond to uncertainty, and how we exercise power and responsibility within healthcare systems. For instance, consider a routine clinical encounter where a physician must decide how much information to share with the patient who has received a serious diagnosis. While medical knowledge provides the diagnosis and treatment options, ethics determines how truth is communicated with empathy, respect, and sensitivity to the patient's emotional state. Similarly, in a teaching hospital, the decision to involve students in patient care requires ethical judgment to balance educational needs with patient dignity and informed consent. These everyday scenarios illustrate that ethics is not an abstract concept but a constant presence in medical life, guiding professionals to act with compassion, fairness, and accountability even in the most routine situations. The discourse on medical education requires a deep engagement with ethics because ethics functions as the invisible architecture supporting clinical competence and academic integrity. Within the demanding environment of medical teaching, ethics is not a reactive mechanism invoked only when problems arise. Instead, it is a continuous guiding force that governs daily conduct, from routine clinical judgments to pedagogical choices that influence future professionals. Whether we engage with the medicine as students, educators, or clinicians, ethical frameworks determine how we relate to patients, learners, colleagues, and society at large. Historically, the credibility and survival of the medical profession have depended on shared values such as honesty, compassion, justice, accountability, and responsibility. These values are not optional ideals. They are foundational commitments that sustain public trust in medicine. This session does not treat ethics as a detached academic abstraction or a theoretical add-on to medical education. Instead, it seeks to facilitate the internalization of ethical values so that they become an integral part of professional identity. Ethics in medicine is a lived practice, often enacted reflexively. The purpose of this lecture is to elevate these reflexive actions into conscious, reflective, and analytical ethical reasoning, enabling professionals to act with moral clarity rather than habit alone. Dear students, let me briefly outline the objectives of this lecture. The objectives for today's session are to get conceptual clarity about ethics in medical teaching, to understand the principles and structure of ethical reasoning, to examine the relevance of ethics across personal, social, and professional spheres, and finally, translating ethical understanding into ethical action, recognizing that ethics ultimately finds its true meaning in practice. Dear learners, let us begin by moving to our first objective, which focuses on achieving conceptual clarity regarding ethics in medical teaching and professional practice. Ethics, as defined by Aristotle as the study of what it means to live a good life and act virtuously within the framework of medical teaching and healthcare refers to the systematic study of moral principles that govern human behavior and professional conduct. It provides the intellectual and moral tools required to distinguish between right and wrong, justice and injustice, and compassionate care from professional neglect. In the field of medicine, ethical clarity is especially vital because decisions frequently involve human life, physical and emotional suffering, patient vulnerability, and outcomes that may be irreversible. A seemingly small decision, such as disclosing a medical error, obtaining informed consent, or prioritizing one patient over another, can have profound moral implications. Ethics functions as a guiding framework that regulates professional behavior in both clinical encounters and educational environments, echoing Hippocrates' enduring principle, first do no harm, which remains a cornerstone of medical professionalism. It ensures respect for patient dignity, fairness in student evaluation, honesty in clinical communication, and accountability in decision making. For example, ethical practice requires a physician to fully explain treatment risks to a patient rather than rushing consent for convenience, and it obliges an educator to assess students impartially rather than favoring personal preferences. Without ethical clarity, technical expertise risks becoming detached from human values, reducing medicine to a purely mechanical process focused on efficiency rather than care. In medical teaching, ethical awareness helps educators recognize that students are developing professionals whose moral character is shaped through observation and example. Likewise, patients must never be reduced to teaching cases, but treated as persons with rights, emotions, and lived experiences, ensuring that medical education and practice remain fundamentally human-centered. Having established a foundational understanding of ethics, we now move to our second objective, which emphasizes familiarizing ourselves with the key principles and methods of ethical reasoning. The key principles include respect for autonomy, beneficence, non-maleficence, justice, respect for human dignity and integrity, and accountability. In the medical domain, a critical distinction exists between technical proficiency and ethical discernment. Scientific knowledge informs clinicians and educators about what is possible, what can be diagnosed, treated, taught, or technologically enhanced. Ethics, however, determines what ought to be done in light of human values, dignity, and responsibility. This distinction has become increasingly significant in an era characterized by rapid advancement in medical technology, artificial intelligence, genetic interventions, and life-sustaining treatments. While technology may enable prolonged life or precise interventions, ethical reasoning guides decisions regarding appropriateness, consent, and quality of life. For example, although advanced life support systems can sustain biological functions indefinitely, ethical discernment helps clinicians determine when continued intervention respects patient autonomy and when it may prolong suffering. Ethics functions as the architect of professional conscience. While academic and clinical training sharpen the intellect and technical competence, ethical reasoning shapes judgment, accountability, and restraint. Medical professionals today exercise unprecedented power over human life through diagnostic authority, therapeutic control, and educational influence. Ethical reasoning ensures that such power is exercised with humility, integrity, and respect for human dignity. For instance, a medical educator must ethically balance rigorous assessment with fairness and empathy, ensuring that evaluation supports learning rather than intimidation or bias. Ethical reasoning is inherently rational and reflective. It requires professionals to evaluate intentions, foreseeable consequences, duties, and rights rather than relying solely on emotional impulse, hierarchical authority, or institutional norms. Ethical frameworks assist practitioners in navigating complex dilemmas where competing values exist, such as allocating limited resources during public health crises. Ethics is also normative and prescriptive, establishing standards of conduct even when they are inconvenient or unpopular. Principles such as honesty, patient safety, confidentiality, and informed consent remain morally binding despite time constraints or organizational pressure. Although medical practices vary across cultures, ethical values such as compassion, justice, respect, and non-maleficence are universally upheld. At the same time, ethics is dynamic and evolutionary, with practices once deemed acceptable, such as paternalistic decision making, now challenged by growing recognition of patient autonomy, equity, and human rights. Dear learners, the methods of ethical reasoning include: number one, principle-based reasoning, also known as principalism. It uses core ethical principles like autonomy, beneficence, non-maleficence, justice to analyze and resolve moral dilemmas. Number second, consequentialist reasoning. This method evaluates foreseeable outcomes of actions such as the impact of prolonged life support or resource allocation decisions. Number third, deontological reasoning, also known as duty-based reasoning, which focuses on moral obligations and rights, including confidentiality, informed consent, and professional duties, regardless of consequences. Number four, virtue-based reasoning, which emphasizes moral character traits such as humility, empathy, fairness, and integrity in professional conduct. Reflective and rational deliberation as a method encourages critical evaluation of intentions, consequences, and competing values rather than reliance on emotion, authority, or custom. And finally, contextual and cultural sensitivity. This method recognizes cultural variation in practice while upholding universal ethical values, allowing ethical reasoning to adapt without losing moral coherence. Dear learners, with the ethical framework in place, let us now proceed to our third objective, where we examine the relevance of ethics across personal life, social interaction, and professional medical practice. Ethics influences the medical professional across multiple dimensions of life. In the personal sphere, ethics shapes character, self-discipline, emotional stability, and moral courage. Personal ethical integrity ensures that professionals act responsibly, even in private situations where no external oversight exists. For example, a physician who realizes after leaving the hospital that a minor medical dosage error was made may still choose to report the mistake the next day, even if it is unlikely to be discovered and may result in personal embarrassment or disciplinary scrutiny. Such an action reflects moral courage and commitment to patient safety rather than fear of consequences. In contrast, an unethical response would involve deliberately concealing the error, altering records, or rationalizing the mistake as insignificant to avoid personal accountability, thereby placing professional self-interest above patient welfare. Admitting errors, respecting confidentiality, and maintaining honest are ethical commitments rooted in personal character, cultivated through ethical reflection rather than imposed by rules alone. This internalized ethical discipline fosters trust, protects patients from harm, and upholds the moral credibility of the medical profession, demonstrating that ethical practice extends beyond formal regulations into the very identity of the healthcare professionals. In the social sphere, ethics promotes justice, cooperation, and mutual respect by guiding how individuals and institutions interact with one another. Medicine is inherently a social enterprise because it operates within communities and relies on trust, collaboration, and shared responsibility. Ethical social conduct helps ensure harmonious relationships among healthcare professionals, patients, families, and the wider community by fostering fairness, empathy, and accountability. It safeguards vulnerable populations such as children, the elderly, people with disabilities, and marginalized groups by preventing exploitation, discrimination, and neglect in healthcare delivery. Moreover, social ethics reinforces the principle that medical progress should serve the common good, ensuring that advances in research, technology, and treatment are accessible and beneficial to society as a whole rather than limited to privileged or powerful groups. For example, during the distribution of vaccines in a public health crisis, social ethics plays a crucial role in prioritizing high-risk populations such as frontline healthcare workers, the elderly, and those with chronic illness. Ethical decision making helps prevent unequal access based on wealth, social status, or influence, thereby promoting fairness and protecting those most in need. In the professional sphere, ethics is the cornerstone of credibility and public trust. Professional ethics governs confidentiality, accountability, transparency, and leadership. Ethical medical professionals uphold standards even when doing so requires personal sacrifice. They recognize that professional authority carries moral responsibility and that trust once lost is difficult to restore. Ethics also plays a crucial role in medical education. Teaching environments are powerful sites of moral formation. Students learn ethical behavior not only through formal instruction but through observation, a process often described as the hidden curriculum in medical education. Faculty members serve as moral role models, and their everyday conduct communicates values more powerfully than lectures alone. Ethical pedagogy fosters fairness, respect, inclusivity, and compassion. For example, a clinical instructor who corrects a student's mistake privately and constructively, rather than humiliating the student in front of the patients or peers, demonstrates respect, professionalism, and empathy. Such behaviors, though rarely written into syllabi, become part of the hidden curriculum, subtly shaping students' professional identities and influencing how they will later treat patients, colleagues, and trainees. In this way, ethical conduct within educational settings reinforces the principle that medicine is not merely a technical discipline, but a moral practice grounded in human dignity and responsibility. Finally, we move to our fourth and most crucial objective, which focuses on translating ethical knowledge into practical ethical action in medical teaching and clinical practice. Ethical education finds its true meaning only when ethical principles are consistently enacted in daily professional practice. Praxis in this context refers to the deliberate integration of ethical reflection with concrete action, where moral reasoning is tested and realized through real world decisions, rather than remaining at a theoretical level. Praxis oriented ethics emphasizes that merely knowing what is right is insufficient unless ethical understanding translates into responsible and compassionate action. In the field of medicine, ethical action is reflected in patient-centered care, respectful teaching practices, transparent clinical decision making, and accountable professional leadership. For example, a clinician who genuinely practices ethics not only understands informed consent but takes the time to explain treatment options clearly, ensuring that patients make decisions aligned with their values. Similarly, an ethical medical educator fosters a supportive learning environment by treating students with fairness, respect, and encouragement rather than fear or intimidation. Core ethical principles such as respect for autonomy, beneficence, non-maleficence, justice, and integrity guide both clinical and pedagogical decisions. Respect for autonomy requires honoring patient choices and recognizing learners as developing professionals with independent agency. Beneficence motivates healthcare professionals to actively promote patient well-being, while non-maleficence reinforces the paramount duty to avoid harm, such as preventing unnecessary procedures or psychological distress. Justice ensures fairness in access to healthcare resources and educational opportunities, particularly for marginalized populations. Integrity binds these principles together by demanding honesty, transparency, and moral courage, especially when professionals face pressure to compromise standards. Ethical action is cultivated through education that integrates reflection, experiential learning, and meaningful assessment. Case studies expose learners to real-world ethical dilemmas, allowing them to analyze complex situations, weigh competing values, and practice sound decision-making in a safe learning environment. Community engagement further helps internalize compassion and social responsibility by placing learners in direct contact with diverse populations and real social challenge. Reflective practices such as journaling or guided discussions encourage students to critically examine their experiences, emotions, and choices, thereby enhancing moral sensitivity and self-awareness. Together, these approaches reinforce the formation of ethically grounded medical professionals who are capable of thoughtful, humane, and socially responsible practice. For example, a medical student participating in a community health outreach program in an underserved area may encounter patients who cannot afford prescribed treatments. Through case-based discussions and reflection on this experience, the student learns to balance clinical ideals with social realities, developing empathy and ethical judgment when considering alternative, accessible care options. In conclusion, ethics constitutes the indispensable foundation of medical teaching, patient care, and professional formation. It shapes both external behavior and internal character. Ethical values provide stability amid rapid technological change and moral uncertainty. By embedding ethics into education and daily practice, we ensure that medical professionals are not only technically competent but morally grounded. Ethics must ultimately transcend theory and become a way of life lived consistently in every clinical decision, teaching interaction, and professional relationship. Only then can medicine truly serve humanity with dignity, compassion, and integrity. Thank you for your attentive listening.